I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of the IDD Health Matters podcast. I have two guests that I can't wait to talk with today. They're both from the National Association of State Head Injury Administrators. We also call it NASHIA. And I'd like to welcome Jill Ferrington, who is the Director of Community Integration, and Rebeccah Wolfkiel, who is the Executive Director of NASHIA. Welcome to both of you.
Thank you. Thank you so much for having us.
So let's just get started with kind of the basics. Becky, would you tell us about NASHIA and how you got involved?
I would love to. So NASHIA is a national membership organization that's been around for over 35 years, and it really is focused on supporting state governments with creating services for people with brain injury across the country. If you can think about 35 years ago, there were seatbelt laws and people were beginning to wear helmets when they're bicycling. Our trauma systems are being developed, and so people are living with injuries that they may not have previously, and needing some unique supports to help them integrate back into community and live their fullest potential. So our organization brought together state governments to problem solve and really try to understand what are the supports and services needed for this population? How can we better serve them through government systems and otherwise? And so today, our organization continues that mission, really trying to bring together partnerships within the state that ultimately provide meaningful and comprehensive services for people with brain injury. I came to this role in 2018. I have a policy background. I really just am so fortunate that I got to know this community through my work on Capitol Hill. I started as my first job on Capitol Hill working for the co-chair of the Congressional Brain Injury Task Force, and his name was Todd Platts. He had a real passion for trying to help support people with understanding that, brain injuries were everywhere and they could be preventable. And there are things that we can do to help, when they happen. So fortunately, I got to work with him for, 6 or 7 years, working on the TBI Act and trying to get supports at the federal level, and then moved into a private sector role where I supported the organization in a government affairs capacity and, working with federal regulators on trying to get some more resources for people with brain injury. And then again, in 2018, became the executive director. So it's a wonderful community to be part of. It's exciting and changes every day. And I'm fortunate to get to work with Jill and others on my team.
That sounds great. It sounds really exciting, and certainly work that's needed to bring awareness to this. And I'm going to ask you in a minute about connections with intellectual and developmental disabilities. But Jill, how did you come into this field?
Well, back when I was in college, I did a short stint part-time job at a rehabilitation hospital in Texas, and I worked with people that had brain injury, pretty significant brain injuries many years ago. And then I went into the vocational rehabilitation field, spent my career there. And then about 10 years ago, I started working more focused on brain injury programming and policy in the state of Colorado, and shortly thereafter moved on to NASHIA, where I am now. I'm fortunate to be able to work on a variety of different types of projects. They all have something in common, though, and that's improving people's quality of life after brain injury. So quite a bit of focus in the Medicaid area, a lot in employment, and just community-based supports that, make a difference for not only the people with brain injury that need it so much, but also their family members and caregivers.
So you mentioned, or your title is Director of Community Integration. And that's something we talk a lot about with people with intellectual and developmental disabilities as well. So I want to come back to that. But right now, could you talk about the connection between head injuries and intellectual and developmental disabilities?
Would love to do that. We have been thinking about this quite a bit at NASHIA, and the fact that in some ways there exists these two sets of people that are likely on IDD systems. They're on waivers for people with intellectual and developmental disabilities. And the interesting part of it is that we know already that many people are in IDD systems because of pediatric brain injury. Their injury happened at an age of, in some states, 22 or younger. Mm-hmm. I think it varies a little bit in other states. And so they find themselves on IDD caseloads because they've had brain injury that also led to significant adaptive impairments, cognitive behavioral concerns. But in addition, we know that there are people on IDD caseloads who are more subject to brain injury as they age. And so we'd love to talk more today about really both sets of those populations that we feel like could, with a little bit better lens, be receiving more brain injury informed, more tailored supports.
You know, that's a really interesting point you made. We think about, okay, some people who had a brain injury in the early developmental period do fit the definition of an intellectual or developmental disability because that injury occurred, you know, in the developmental period, and it results in what are considered permanent, you know, unchangeable deficits. But the other part you mentioned, which is so true, and certainly in my own experience as well, is that people with IDD are often more prone to experiencing head injuries. And I can't tell you the number of people. All right, so we know seizures, much more common in people with IDD. Up to 25 to 30% of people with IDD have seizures. Seizures are a big risk factor for falls and head injuries. I'm sure there is some research out there, probably not enough, but I'm sure there's some research out there related to head injuries in people with intellectual and developmental disabilities and connections. So Jill, can you share some of that?
Yeah, I for sure can. There was some interesting research back in 2021 that was in the Canadian Journal of Neurological Sciences. That study looked at a number of cases over a 15-year period. So it was a very large sample from Ontario. And what they found in that very large sample of people with IDD was that adults with intellectual and developmental disabilities experience double the incidence of people in the general population. And that really stood out because we know that people experience falls in different ways. Epilepsy is a condition that can certainly result in falls. Sometimes people with IDD have mobility challenges, or they may be on medications that, can cause some side effects that result in falls. And sometimes we know that there's even just environmental barriers. And the research kind of got a little bit more detailed and showed that males and in the 18 to 29-year-old age group were even more subject to that incidence, which parallels with the general population, but again, is twice as likely. So what we find with that statistic is that these opportunities to talk are really good ones, because if we can do more screening of individuals as they progress through service delivery, the years that we're working with people, especially if something's changed, we may very well find that a fall occurred, that the person may have lost consciousness, but you don't always have to lose consciousness to have had a brain injury. So really important, I think, data that helps us to know now that in addition to all of the individuals that had pediatric brain injury, that we really should be paying attention to that adult population as well.
That dovetails so well and just really supports my own personal experience. I mean, I saw lots of people with intellectual and developmental disabilities who definitely had increased head injury numbers. Many times it was due to seizures. We know that seizures is the incidence of seizures is much more common in people with IDD, which precipitates people falling, having head injuries, and then you mentioned some of the other things. Sometimes people are on too many medications, and medications can be sedating and disorienting and affect balance and can increase the risk for falls. Sometimes there are mobility challenges. I mean, you really hit all of the things, which makes it even more important for our supporters out there to recognize the impacts of a head injury and what to look for, what to do about them, and how to support someone who has experienced one. So, Rebeccah or Jill, are there any particular tips or trainings that you talk about or things that people should learn about related to head injuries?
I will start. I think that I think a lot about case managers because they're oftentimes the first one to know that the person that they're working with, especially if it was that pediatric brain injury, is someone who needs to be served with that little bit of a different lens. They can then build brain injury informed and supportive services into a person-centered plan. And the most important thing I think they can do is let the service team know that they're working with somebody that has a brain injury, because my hunch is that doesn't always happen. We had discussions with one state where it was clear that individuals would come through eligibility with a technician who would find the person eligible for IDD services, and then they moved on to the case or care manager. So if that data of the cause or the reason for the eligibility gets lost anywhere in there, it could be, detrimental and perhaps result in service challenges, frustrations on the part of the service team. So it feels like the linchpin to me are the care managers. So if they're trained on brain injury, if they understand how and the best approaches to screen for brain injury, it just kind of uncovers, what might really be going on. And then working with service teams to adapt in oftentimes pretty small ways. Sometimes we even say they're pretty universal approaches, but there really are some differences when addressed in a more tailored way that people can respond better to, their programming.
And I would just add to that. Sorry to interrupt you, but
please.
There are validated screening tools that do provide some of these tailored approaches for case managers and families. And they can, learn what the specific challenges that individual might be facing every day, and some specific accommodations and strategies to incorporate not only into service provision, but also for that individual and their family to incorporate into daily living practices that really can go a long way. And as Jill mentioned, they can be very simple strategies like supporting, memory and cognition that we can use our iPhones for, reminders, setting reminders. We do support a validated screening tool that was developed out of the Ohio State University. The OSU TBI ID, and it does determine if someone has had exposure to lifetime TBI, but also brain injury that could be caused by a non-traumatic event as well, like a stroke or a seizure or loss of oxygen to the brain. We pair that screening tool with a symptoms questionnaire that really helps someone understand that, yes, I not only have been exposed to a brain injury, but these are some specific challenges that I'm experiencing each day. And then again, our tool helps support specific accommodations that can be incorporated. So it's not quite just enough for someone to understand they have had a brain injury. It's sort of the, well, what does that mean and what can I do about it? That is so important.
I think that is of, that's paramount. I mean, because, oh yes, sometimes it's kind of, I don't want to say easy, but relatively easy to identify. Well, somebody had a head injury. But what do we do? What do we do differently? Are there different ways we should support someone who has had one? And are there preventive things that we can do to prevent people from having repeated head injuries? And or is there information out there about that, about prevention of head injuries?
Yeah, we feel like that is a key area that, could even lead to some recognition around policies for thinking about prevention for the IDD population, just as we think about it for the aging population, thinking about home environments and how things are set up in them, making sure that we're considering, other risk factors like the ones we talked about earlier, and making sure that, medications are working appropriately. So thinking about, I think the prevention area is a big opportunity for the IDD system. And then to your point as well, there's just these kind of small adjustments that can better help individuals with brain injuries, more fully engage in, for instance, their own care planning, their own person-centered planning by, acknowledging that somebody with a brain injury may be differently than a person with IDD, might be experiencing more sensory overload or fatigue, and may need to break up their sessions into a couple, to really achieve a meaningful person-centered plan. We know that having greater structured routines and memory supports, like Becky alluded to earlier, can be very helpful. So just, once we know that the person that we're working with has that specific condition, then we can make those small adjustments for a better, I think, outcome in the end.
So, Jill, you mentioned some things that are a little bit different in supporting people who have an intellectual disability from some other cause that's not a head injury related versus someone who has an intellectual disability related to a head injury. Are there some other things to consider from a supporter standpoint that would help?
I think when we're talking about people with brain injury, a couple of additional considerations might be that an individual has reduced self-awareness, a little bit less insight. And then oftentimes a biggie that we have to think about and talk about with case managers who we do trainings with is that a person had their life before, and then they have this new life after. And sometimes that can result in much sense of loss. Sometimes trauma was associated with an injury like we're talking about. And so factoring that into, more trauma, the trauma-informed person-centered planning and ongoing case management, it's just subtly different sometimes, I think, than working with somebody who has had a disability throughout their life. So those are a couple of areas. And, we talked a little bit about fatigue and overstimulation. You may see certainly that among people with IDD as well, but we know that those are pronounced and the kinds of symptoms that come up much more frequently in the people that are screened in our experience. There's so many just important points that both of you are making here that I've practiced medicine in this field for many years, and I haven't really appreciated the things in the way that you're describing them. I think it's hugely important that we get this information out to supporters of people with intellectual and developmental disabilities. It really is extremely valuable for everyone to understand
the connections and the differences in supporting people with or without head injuries, because the better we understand these situations, the better we may understand why a person does a certain thing or doesn't do a certain thing, and the better we're able to help them. So it really, this is important information. I'm really glad you both are here talking about this today. I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. There are probably a few key points or takeaways that you both have, but I'm going to frame it in the way I usually frame these things, which is 3 things in about 3 minutes or so, but you don't have to hold to 3 minutes. I call it 3 and 3. So what are 3 tips, 3 words of wisdom, 3 pieces of advice that you think are really important for people who support those with intellectual and developmental disabilities to know and to understand about traumatic brain injury that can improve health and wellness and outcomes for people with IDD? And before you answer, since there are 2 of you, you can go anywhere between 3 and 6. I'll let you decide.
We appreciate that. Maybe Jill, I'll start with a couple and then turn it over to you. I think, first of all, it's important for supporters of people with IDD to understand that a head injury it doesn't just occur maybe midlife or, later in life. It really could have occurred before you even got to know and began supporting that individual. They may have had a brain injury early on, and that was why they were, placed into the waiver services. And along the way, the brain injury has sort of not been continued to be discussed or recognized, although those symptoms are still persisting and impacting the person's life. So I think one is that sort of just recognition that brain injuries can happen across the lifespan. But second, we try very hard to sort of demystify brain injury. Brain injury is nebulous, and it can, every brain injury looks different, and that can be scary for healthcare providers and family members and individuals themselves to really wrap their minds around, well, what does it mean that this person has had a brain injury or more? And I think, as Jill has done a really nice job of articulating, there really are simple accommodations and strategies that we can adopt and we can incorporate into lives that make really big differences for people. So understanding is huge, and there are real strategies that people can incorporate that are very meaningful. So those would be my 2 highlights, but I know Jill has more.
Well, I just want to piggyback on what you said, Becky. Sometimes what we'll hear people say is, but I'm not a brain injury specialist. I didn't get that, education. And that is the myth that I think Becky's really highlighting, is it doesn't necessitate having brain injury specialization. You don't have to have additional letters behind your name in order to adequately support people with brain injury. Another thing I would like to point out is that there's so much opportunity for collaboration at the state level. We have brain injury associations and state programs on brain injury throughout the country. They all look a little different, from state to state. But if we, I think, can all work together to bridge, the IDD partners with the brain injury partners, it might result in great referrals for some specific brain injury support groups, brain injury informed peer supports. I mean, there's so many different interventions that if we can shed light on them, may just enhance the quality of life for the people that we're serving in that system. And the last thing I would love to see happen is that over time, we take that indication of brain injury as the reason that somebody's receiving services, or that they maybe experience brain injury later in life, and that's sort of flagged in the data systems that IDD care managers and supervisors and service teams are working with, so that it's just less behind the curtain.
Well, all of those are excellent points and things that I hope everyone is really paying attention to. I'm gonna use my prescription pad at the moment and write a prescription for everyone out there who's listening. If you are supporting a person who has a history of head injury, reach out to the TBI organization in your state and learn more about it. Learn more about what you can do, how you can support people differently. And there's certainly value in that, and it can improve the support that a person might be receiving. So reach out to learn more. And Rebeccah, if people want to learn more about NASHIA, how do they find you?
Yes, we have a great website with lots of information for all sorts of people, individuals themselves, but also clinicians and caregivers and state programs and community partners. So our website is NASHIA.org, NASHIA.org. You're also welcome to reach out to Jill or I anytime. We would love to connect you with partners and resources in your state.
Well, Becky, Jill, thank you so much for taking the time to talk with me today about this and provide such important and valuable information to supporters of people with IDD and people with intellectual and developmental disabilities. Really, again, thank you so much. And thank you so much for the work that you are both doing to raise awareness and to improve supports and services for everyone.
Thank you for having us. This was a pleasure.
It was definitely a pleasure. Thanks so much.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.